Hello, my name is Diedre Morris. I am an RN BSN, graduated from EKU. I've been a nurse for 17 years, and 7 of those years I worked in family practice. That's where my passion started for understanding how relationships can form with individuals, and you can work to keep them well, and then also to address things that could be potential illnesses and to help redirect so to fix things upstream, hopefully before it gets too bad. So my subject matter for this project was hypertension treatment with exercise. Hypertension is something that I see every day working as a nurse. According to the Office of Disease Prevention and Health Promotion, heart disease continues to be a leading cause of death in the United States, and nearly half of adults have hypertension, according to the Centers for Disease Control. So, upon looking for research information, I found lots of articles about how physical activity and exercise can help. I chose three that were very strong. According to Cole, an 8-week course of stepping exercise significantly lowered systolic and diastolic blood pressure. According to Sherifel, leisure time physical activity found that walking and high intensity physical activity decreased systolic and diastolic blood pressure. And then with Baldino, patients with self-managements of healthcare support the ideal of the patients with hypertension can decrease their blood pressure by using lifestyle modifications such as exercise as part of a healthy self-management program. So one of my favorite theorists is Imogen King, and her theory of goal attainment fit with this. It's based on perception, communication, interaction, transaction, self-row, growth, and development, coping with stress, time, and personal space. That's from her 1992 work. And then her 1981 work is the theory describes the nursing client relationship that leads to achieving goals as interactions to mutually establish goals and explore and agreeing on a means to achieve the goals. Hypertension has many different ways that it can be addressed, whether that's exercise or diet, and then medications. And so it's important when we are working with individuals to discuss what their goals are, what their potential resources and barriers are, and what preconceived notions they come in with. Some people truly think, well, medicine is the only way to treat hypertension. So addressing those things and talking with them will be of utmost importance. So when we get into the implementation and the timeline, it's kind of going to overlap a little. But so for implementation, when patients come in to a clinic, normally their blood pressure is checked. So that will be something that we'll continue to do. But when the next step will be when the nurse or the CMA is doing that blood pressure, if it's above 120 over 80, they're going to give them a blood pressure card, write that down, and tell them that the provider will be in shortly to talk to them, that we're just trying to keep an eye on people's blood pressures. So when the family nurse practitioner comes in or the doctor, they're going to look at that card. They're going to look back at blood pressures and see if it's trending elevated. And if it is, go ahead and have a conversation with that patient about the risk factors for hypertension, short term and long term, and the evidence base of activity such as exercise being able to help treat that and to prevent it from getting higher. We're going to have flyers that have information on it about exercise, evidence-based information, articles, websites. And then there's also going to be an exercise log in there, along with an area to write down the blood pressure that they'll be monitoring at home, and phone numbers that they can call or text if they have questions. And just a basic breakdown of how this could help even on a short term, because some of the articles found that within 4 weeks they were already seeing a decrease in systolic and diastolic. And so the next step will be we will give them that information, then we will have them come back in 4 weeks. And that will be to see how their blood pressure is doing at home, how they're doing navigating the exercise, doing physical activity, if there are potential barriers, if there's a lack of education in areas, and to see if even potentially they may have changed their diet also, just to see what's happening. It's going to be important to discuss with them on that first visit how they're going to have their blood pressure checked. So that will be when we give them the flyer. Also discuss with them if they would be able to check it at home, or if they would prefer to stop in the clinic, or if they would prefer to go by somewhere like a pharmacy or a store that may have a way to check their blood pressure, and just to go ahead and have that in the works of how is that going to happen every day, and discussing checking at different times of the day. So at that 4 week, we'll decide if the plan needs to just continue the way it is or if it needs to be changed. And if their blood pressure is below 120 over 80, then the discussion can happen of if they think this is a plan they can continue, then we can bump it out to 12 weeks with the agreement that if they see that their blood pressure is trending up or there's changes, to let us know. When they come back, the next 4 weeks, we'll evaluate again. And during this time, we're going to be having clinic meetings every 4 weeks to discuss what we're seeing, because sometimes patients will talk to the nurse or the CMA that's rooming them more so than the provider. And so just to discuss if there's things that we need to look at that we need to potentially change, or if the providers, including the nurses and the CMAs, are seeing something that maybe could be done in a more efficient way, then we can do that. Once it's been the 16 weeks or before, if we see that there's, potential of significantly higher blood pressures, then we may look at, do we need to start a medication alongside this, and how the patient feels about that. Of course, always putting their clinical needs in the forefront. Patients will have a phone number to text or call if they're having symptoms or they're having trouble meeting the guidelines. If something changes and there's an illness or there's a problem, finances, and they were going to a center that they were exercising and had to pay for, so that we can have this ongoing relationship. So the outcome measures is that patients diagnosed with hypertension will meet the guidelines of a normal blood pressure of 120 over 80 or below within 4 months. Documentation will be ongoing with anonymity, and we will share it with the other patients under the anonymous if the patients are willing to let us do that. And we'll also be sharing within the clinic meetings so that we can have morale of seeing things that are going well, and also have conversations on things that maybe aren't going as well with the clinic, so that we can see if we need to change things. So timeline, we're looking at the very beginning, seeing they have blood pressure, hypertension, or are headed that direction, giving them blood pressure cards and information on that first visit, a follow up in 4 weeks, and we'll do a follow up every 4 weeks for the 4 months, unless there is a reason we need to get them in sooner, or unless they're meeting the goals, then we may be able to push it out a little further. And if their blood pressure is trending down and the exercise program is working well for them, then we could go to every 3 months and just have them contact us if there's a problem, or if they're having symptoms, or they're seeing their blood pressure trend up. And we can look at that. Or if there's an illness or something where they're like, okay, I can't do the exercise, the physical activity right now. We will have, along with that flyer at the beginning I'd mentioned that was going to have evidence based, we will also have resources and networks and ideals for physical activity and things that they could do. Um, so there's references on my poster. The poster's here in the background. If you want to take a look at those, and maybe that's something hopefully you can use in your future practice, or even now as you're taking care of patients. And blood pressure, hypertension is something that often people forget impacts daily life before it even, has the bigger effects of cardiac and kidneys, with people having fatigue and headaches and lack of energy, so that they can't do as much with their family members or do the activities that they enjoy doing, and even impacting their work of being able to go to work all the time. Because when things happen, your blood pressure has an overlying effect on every system in your body. And so if we could help other clinicians understand that, and also patients, before it gets to the point of thinking, oh, well, it's okay until it gets as high as, the 140, 150 over 100. Understanding the underlying effects of, like, you feel better when it's better controlled. So I look forward to reading your comments and hearing the things that you all have to say. Thank you for taking the time to watch my video and share your thoughts with me. Thanks.